Good morning, good afternoon, good evening, wherever you are. My name is Stephen Goldstein, and I'm the director of the Taiwan workshop at the Fairbank Center at Harvard University. And I'm very pleased today to moderate a roundtable on the COVID-19 virus and the experience in Taiwan. We just start off with a few thoughts. Taiwan appears to be the land of miracles. In the 1970s, when I was I was more than a graduate student, the Taiwan miracle was the economic transformation that took place in Taiwan after the establishment of rule on the island. In the 2000s, or in the turn of the 20th century, the Taiwan miracle was a political miracle. It was the democratization of an authoritarian regime. And now people are talking of a third miracle, Taiwan's response to the COVID-19 virus. You see, the more I read about it, the more I see terms like gold standard being used to characterize the Taiwan experience. Miracle is not a good word because every one of those miracles, including the miracle today, has been the result of political leadership and societal participation. They're the result of policies led by political leaders with the participation and cooperation of the people. This was unquestionably the case in the first two miracles, and today it's becoming increasingly clear that the same holds for the present miracle. Political leadership, societal effort, combined with technological capabilities, social policies, government institutions have all played central roles in Taiwan's response. Today, we're going to look at that response, and we're very fortunate to have some excellent guests to take part. From Taiwan, we have Ren-Xiang Chuang, who is the Deputy Director General of the Centers for Disease Control. We have Stephen Guo, President of National Yang-Ming University and former head of the Centers for Disease Control. We have Winnie Yip on the Harvard side, who is a professor of global health and economics at the Harvard T.H. Chan School of Public Health, and William Hsiao, who is the K.T. Lee Professor of Economics, also at the Chan School of Public Health. I've asked Professor Yip to make a few introductory comments, and then we will go to a roundtable format among the participants and end with questions from the viewers. When that time comes, or during the talk if you'd like, just simply press the Q&A tab at the bottom of your screen to submit questions. You may choose to remain anonymous, but otherwise, please provide your name and institutional affiliation. And finally, we expect to receive more questions than we're going to be able to answer. Not that we won't be able to answer, but the constraints will be time. I think with these people, we should be able to answer practically anything. And so we expect to receive more questions than we'll be able to answer. And I hope you'll understand if your question is not introduced. So, Dr. Yip, would you like to begin?
Great. Thank you, Steve. Good evening to our friends from Taiwan. As Steve said, Taiwan is holding up now as the gold standard in the response to COVID-19. So we're delighted to have this opportunity to hear from you what you do and share lessons for others. Now, for the audience who may not know, with a population of 23 million in Taiwan as of June 1st, the total accumulated cases of COVID is only 443. Well, we wish it is zero, but if you look at what is happening in the United States and many other countries, being able to control it at 443 and the number of deaths is only 7 so far, it is very admirable. And we wish every country could do it. And you were able to, I mean, if I would quote what my epidemiologist colleague would say, you were able to manage the situation and control the growth of the number of cases so it doesn't go into exponential growth. Because once it goes into exponential growth, it is out of control. There are many things you cannot do. And I think you are very successful by preventing that in happening. And because of that, you also avoided shutting down the economy, shutting down schools, shutting down society, which of course have major consequences and therefore much more difficult in recovery. And also your healthcare system do not get crushed, if I may say so, because you were able to really intervene early and also fast. So again, as my epidemiologist friend here would say that, you know, with infectious disease, it's always about speed, speed, speed. And in this particular case, because COVID is transmission is also asymptomatic. So the other keyword is test, test, test. And Taiwan seems to be able to adhere to speed, 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 and also do test, test, test. So I think that it would be wonderful if we can hear from you. If I may ask Dr. Chuang to share with us briefly on what are some of the strategies that Taiwan introduced, especially in the early phase. I mean, I understand that even on December 31st, when WHO was informed by the Chinese government of COVID-19, you already started some measures on border control and then gradually take a very nuanced approach to expand it. And therefore, and this is rather, I'm sure it is rather difficult because of the huge volume of travel between China and Taiwan, the large number of people who actually live in China and work in China and around Chinese New Year. And you also deploy technology beautifully and using the database that multiple database, including the National Health Insurance Database, the Immigration Database, to help you with case identification. So it would not be just do justice for me to say it. So we're delighted that we would love to hear from Dr. Chuang. What are some of the key strategies that you adopt for that allow you to prevent the epidemiological curve to become exponential, if I may say that. And then I'd like to invite Dr. Guo to perhaps list 3 lessons for other countries. Now, before the talk, actually Dr. Guo reminded us that today Dr. Chuang is the spokesperson for COVID response. 17 years ago, he was the spokesperson for SARS, so we are very delighted to have both of them here. So with that said, can I invite Dr. Chuang to just give us a brief overview of what you did, and then Dr. Guo.
Okay, everyone, thanks for inviting to participate in this online presentation. For Taiwan's experience in combating the COVID-19, so I will share our experience. First, I think we have a very rapid response for the early warning. For example, on the December 31, 2019, we learned from the PTT, that's a large online forum in Taiwan. There had been at least 7 cases of typical pneumonia and they were isolated in Wuhan, China. So at that time, because we have some doubt on this news, so we sent emails to the WHO and Chinese CDC for the further information. So we also implement the onboard quarantine of our passenger from the Wuhan at the same day. And since that day, we had a press conference every day to communicate this situation, the everyday situation with our public, and share our public and the journalists about what's the situation in Wuhan. And although we only got some very formal report from the China CDC, but we report such kind of information to the public, but we also to convey our some kind of document about this information to tell our people to know, because we don't know is this disease human to human transmission or not. We also don't know what's the transmission, what is it transmit from the animal, or is there any source of infectious agency? So we are trying to analyze such kind of information with our public every day. Then we also try to establish our diagnostic kit after the China released their genetic sequencing. So on January 15, we have listed this disease as a notifiable disease according to our Communicable Disease Control Act. So, and on the January 20, we activate our Central Epidemic Command Center. So let us can be mobilize all our resources and cross our department effort to combat this disease. So it's fortunate 2 days later, we got the first cases of the COVID-19 case from the Wuhan. So it demonstrates our ability to diagnose the disease. And later we use the contact tracing. We use our because in the past years we are trying to contact tracing every minor case. So if there is any minor case occur, we use our staff personnel to try to investigate every potential their contacts and try to monitor is there any case occur during this follow-up period. So in the past years, we use the contact tracing for the TB, measles, of the control such kind of disease. So so happen for the COVID-19, it's just like a very good experience for us to do it. And we also try to our expert panel also instruct us how to update our definition of case frequently. So in the first beginning, we only focus on the Wuhan traveling history from the Wuhan. Then later we to expand our travel history such as Hubei or from other places. So, and also include other symptoms into our case definition. And I also want to share our another experience is we have the retrospective testing of the negative cases of the influenza with the severe complication on the 15th February. So because of this strategy, we got the case 19 of the COVID-19 in Taiwan, and this case occurred in the hospital and also transmitted to his family. So it's very fortunate for us to catch this case very early to avoid the further transmission around the hospital. And so another thing is the digital. I'd like to share. We have some kind of advanced technologies, such as we combine our national health insurance data with our migration travel history. So when the patient go to the hospital, when he presents his national health insurance card into the to the clinic, the doctor can notify is this patient have any travel history in the recent 14 days to alert the doctor for is this a possible potential case of COVID-19. And we also have another digital smart technologies like digital fence system for the people underlying the home quarantine, because we use this cell phone, the signal from the cell phone, and to check with the nearby cell site. So and if these people have out of the range of the designated house, then the police will gather a notice alert and try to figure out is this person did not obey our home quarantine rule. So the police will go to check this situation and to if this person also break the rule, then he will have some penalty for some money. Okay. So this some introduction of our current strategy for the COVID-19. Yeah.
Great, thank you very much. There's so much there that I'm sure that we can come back to some of those during the discussion and the Q&A as well. Dr. Guo, 3 lessons.
Well, first of all, I'd like to thank to invite me to join you. Well, I'm not quite sure so I can say any kind of lessons that are useful that the people can learn from. But indeed, we are kind of happy and proud of the fact that we are one of the very few success story. Like you said, I'm not quite sure it's a miracle, but at the least we are happy the fact that we can control the outbreak in the very early on. And I think the result, like Steve and Winnie said, is really a combination of a speed, solidarity, the leadership, technology and trust, leadership, and perhaps luck. And actually it's mainly luck, I would argue, you know. For instance, we have a vice president who happened to be a top epidemiologist. And he also, the former health minister who was appointed as a minister in the middle of SARS outbreak in 2003. And we are lucky that we have a health minister who served as a commander-in-chief and who happened to be a great communicator. Yeah, and that's luck, I would say. And also, it seems to me that among all the cases we have, there's none, as we can call it, the super spreaders, okay? And that's probably luck. And perhaps most importantly, we are lucky that we have a single payer national health insurance program, in place for 25 years that Professor Hsiao helped to build, and that is really serve as a foundations, to link and to provide a affordable cares and the trust to the people. And also because the information technology and the infrastructures, and so that serve as a platform, like you said, they can link all the data set together. So I'm not quite sure, so I can say, there's 3 or 4 lessons we can share with the other country, but I'm pretty sure speed is the #1 things. And perhaps test, I would probably argue, mass testing is not the idea. So I have a problems with the WHO saying, the key is test, test, test. I would probably like the WHO say is mask, mask, mask instead of test, 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 And so, and definitely, I mean, risk communication is very important. I think Dr. Chuang and the commander-in-chief, the professor, Minister Chen, spend hours every day, talking to the public in a daily press conference, and it really helped. I mean, it calmed the people, provide the right and coherent, consistent message to the public. And so I think all of them is would be probably the reasons that we have the successful results so far.
Great, thank you very much. I can't help to ask a question before I turn to Professor Hsiao to ask some question. Is this test, test, test versus mask, mask, mask? Maybe I'll cast the question a little bit broader. That is, one of the challenge of COVID-19 is that transmission can be asymptomatic, which is different from SARS, which makes prevention much more complicated. What would you, you can say advice or you can say reflection, given these characteristics of COVID-19, what would be some of the more effective or nuanced strategies that also can be deployed very quickly? Here in the US, we talk about tests, but then we also run into all the blunders of not having the right test. And so I'd love to hear from both of you. What are your thoughts on the fact that COVID is asymptomatic, and given that characteristics, what would you recommend?
Okay. In my side, I think we did the testing for isolating the case from their context, and after we identify the cases and the context, the case will be treated in the hospital, and the contact will be home quarantine for 14 days. So if there is any symptom case, they also within their home will not spread to others. And this also applies to the traveler, inbound traveler. So if they got the illness from the from the other country, and after they entry into Taiwan, they also have the 14 days of quarantine. Then it's not is he a symptom or not, or a symptom? It will be quarantined and will not transmit to other person. And finally, we also because in Taiwan, air pollution is very severe. So many people wear their face masks frequently. So in Taiwan, healthy people also wear the face mask, and I think this time we can combat the COVID-19 very successful. Wearing the face mask may be also some kind of good measure to combat this disease. But for some other country, they don't. They may think wearing the face mask may be very strange. So it maybe did not work very well. So that's my opinion.
Well, I certainly agree. You know, it's very important to understand that the SARS is quite different from COVID, because COVID later on has been proved that can transmit asymptomatically. Well, actually, in the early on, we have that question is whether or not they really like that. And actually, people like Tony Fauci's in the very beginning argue probably asymptomatic transmission is not really the drivers of the outbreak. And, you know, the argument is the same in Taiwan early on. So that I say, I mean, so it's kind of lucky for Taiwan, because people are really kind of scared during the SARS outbreak. And because of they are used to wear masks, or either because the air pollutions, or because people you know, riding bicycle in Taiwan, and they are used. And but anyway, you know, people kind of believe the mask can help. And so in the early on of the COVID outbreak, actually, so we have the problem of a mask shortage. So the government has come up with some measures to rationing the mask in the very beginnings. Just fortunately that the supplies catch up, and so we don't have that problem. But the asymptomatic transmission is somewhat a key in this outbreak, definitely different from the SARS. Now, so the question is whether or not the test can solve the problems, okay? I would argue that in Taiwan, although we didn't do the mass testing, but we do the test precisely, or I would call it precision testing or precision public health, instead of, you know, trying to do the mass testing like, or, you know, lock down country, or a blanket order to ask the public to stay at home. We are doing more precisely. We are using scalpel instead of a hammer, so to speak. And so this has to definitely have some positive effect on the outcome of the outbreak. And definitely, like you said, I mean, it didn't hurt the economy that much.
Great, thank you so much. Lots of lessons for especially the US to learn from. And I understand that you're actually doing a lot of work to precisely identify the population into different risk groups, and therefore you can be much more targeted and nuanced in doing testing or quarantine and so on. So let me turn to Professor Hsiao, whom I think have lots of questions for both of you. Bill, please.
Well, my First question is that you emphasize speed is the key to contain this virus. Can you share with the audience to have a speedy reaction, you have to be prepared. And you did the preparation for such kind of outbreak. You learned from SARS experience. Can you tell us a little bit more in detail what preparation you had done?
Okay.
Okay,
Okay. Well, actually, like Dr. Chuang just mentioned that, well, in the end of the last years, right, we can pick up the signal from the social medias. Well, how do we can do that? You know, is precisely because after SARS outbreak, we have put in place a surveillance systems, which actually is run by Dr. Chuang. He is an expert of bioinformatics, and I'm lucky that I can recruit him from Yang-Ming to the Taiwan CDC. And so in a sense, after SARS outbreaks, we put in place a surveillance systems. Well, maybe Dr. Chuang can elaborate a little bit about all the system we have. And the system, the monitoring surveillance system is not only monitoring and collect the data from our hospital or clinics or ER or, or the National Health Insurance. They also monitor, social medias and the news report around the world. And that's why we have the capacity to pick up the signal very, very early on. And once we pick up the signal, as I understand, we immediately sound the alarm, okay? So everybody knows there's something. And because, like you just mentioned, people are scared during the SARS outbreak. So in a sense, the society is immunized in a sense, by the SARS outbreak. So when they heard the term coronavirus, 冠状病毒, they are scared. And so they are voluntarily to collaborate, or, they change their behavior immediately. And that is one of the examples that we prepare for the next pandemic by putting in place a surveillance system that I would say is a, something we really kind of are proud of. Yeah.
I will introduce our medical officer, Dr. Angela Huang, to answer this question.
Hi. Right. So I'm Angela Huang. I'm one of the medical officers here at Taiwan CDC. So with regarding to all the preparation that we've done over the last 17 years since 2003, the SARS outbreak, I think one of the things that Dr. Guo had mentioned is very important is our rumor surveillance, and that was put into place by Dr. Chuang. And I think in addition to that, we have, over the years, we've learned the importance of having our laboratory capacity. And so that was built up over the last 17 years or so since our last SARS outbreak. So, we were able to quickly get our laboratory testing capacity and get that ramped up and have that our central reference laboratory acquired the testing kits, or actually they set up their own protocol for testing, and very quickly got our contract laboratories and to be involved so that we can increase our laboratory capacity. So by doing that, slowly expanding our laboratory capacity, right now we can test about 6,000 specimens a day, and that capacity is all over the island. So I think that's one of the important things that we were able to diagnose and identify patients very quickly. Another thing is that, you know, during SARS, one of the important thing was that the disease was transmitted from patients to hospital healthcare workers. So one thing that was important, an important lesson that was learned during SARS is the importance of having each hospital needing to have their own infection control protocol in place. In fact, this is very, very much stressed throughout the country that we also have a hospital network that is specifically trained to deal with things like this. So a pandemic. So, and you know, in the last 17 years, we have H1N1, we've had Ebola, we've had H7N1, we've had MERS, and all these diseases, whether they came to Taiwan or not, we were able to activate and practice our hospital network. So each hospital understands the importance of asking each patient about their travel history, about their contact history, and about their symptoms. And each hospital understands how they need to respond when patients of suspected diseases like COVID-19 or MERS or Ebola, how they need to contain it and prevent the disease from spreading in hospitals and to our healthcare workers. And I think one of the things that's also very important was that we have the laws and regulations that was put in place so that, you know, we can get things mobilized very quickly when we do have things like this happen. Over.
Well, the other thing I would like to add, if I may, is that, you know, after the SARS outbreak, we recruit and add more than 30 medical officers, you know, really young and talented medical officers like, you know, Angela Wong, just, you know, we just heard her saying about, you know, all these ideas. And actually, many of them, we send them to Atlanta, US CDC for training 2 years as EIS officers. So as I remember, actually, during a period of 10 years from 2005 to 2015, at any given times, we have medical officers in Atlanta trained as an EIS officer, but also serve as a liaison for us and connecting Taiwan CDC and the US CDC. We have another one in Europe serving as a liaison to European CDC. And so that is all part of our preparations. You know, we have this extra manpower. So in the case that we have outbreak like this, then we can use. Yeah.
Do you want to continue with y'all?
Well, I don't want to ask too many questions. Again, this is on the really early action. You are able to test the travelers, but how quickly are you able to develop good tests? Since the DNA sequencing did not occur until the sequencing of the virus did not get announced until January 7th. Did Taiwan develop its own testing, or do you rely on the Germans' tests? Because the United States CDC trying to develop its own tests, and it did not work out.
Right. If I could just attempt to answer this because I'm not a laboratorian. So we actually relied on the WHO protocol. So as soon as the sequence was published, we were able to design the same sequence. So basically that's what most countries were doing. So we looked at the WHO's protocol, but we also looked at the protocols that was used in Japan. So, but the protocol that we were using is, and we are still using, is mostly based on the WHO protocol.
That's the German system.
Yeah, that's the German system. You're right. Yeah.
Yeah.
I want to ask a question about what you use the commander-in-chief. Now in the US, we keep saying that we are lacking the commander-in-chief in our fight against COVID-19. Taiwan has the Center for Epidemic Controls Center. And can you share with the audience a little bit of what is the function of that center, and based on what would trigger to activate it, how is, who leads it, and how does it make decision? What power does it have in terms of decision making, and what decision still needs to be approved by others? It's a set of governance question, and again, this is a question that we have seen in many other countries. Is there one person or one group that actually can make decision very quickly, and based on what, and how is it being activated? So can you share a little bit of that with us?
It's a very tough question. We have the Central Epidemic Command Center activated on the January 20th. We have 3 labels. For the January 20, we activate the how to say the level 3, the level 3 command center. That's our Taiwan CD Director General of Taiwan CDC as the Commander-in-Chief. So in this level, based on the severity of the disease, then we will change the label to level 2. So level 2 is chaired by our Minister of Health and Welfare, and Dr. Chen lead the commander, and on the level 3, on level 1, also the Dr. Chen, but it's how to say it's from the Executive Yang to give him the power to lead the command center. So after increase to the level 1 command center, you can see all the cross department they change their step. The deputy minister will become our step of the command center, but in the level 2, only the low level of the step come to our command center. So when we increase our level to level 1, so we have more power on the cross department to make a decision for any measure. So for example, to decide to close the border, I think it is not from our commander. It will be from our president. President's his how to say her decision. So so there are a lot of the Executive Yang also they also help us to do it. So you can see from the news, our Vice Premier of Dr. Chen-Hsiang, he also helped us to have the meeting with us and to help the when our minister Dr. Chen to make a decision for any top question. So we also have the everyday press conference led by our commander, Dr. Chen. So he's a very nice people, can explain any question to the public and the journalists. So every people, because his presentation in the conference, so every people very like Commander Dr. Chen. And recently, because we don't have the new new local cases, so every county, every mayor of the county like to invite him to go to their county to sell their agriculture. So currently, he is a very good model for the to transmit the transparency of the information to the public and to explain every detail of our decision to the reporter. And every people in Taiwan very like our commander. So I think this is my explanation.
Right. So this command office is headed by the Minister of Health, but yes. With members that are deputy minister from across a number of ministries, including transportation, economy, education, etc., that would allow them to make cross-sector decisions that are relevant, but also yes. backed up by the executive yuan's authority to make decision. Bill, do you have another question before I ask another one?
Well, I think this is on many people's minds that Taiwan has been excluded from WHO because of China's opposition. And do you think being outside the WHO has hindered your effort to contain, control, and manage this virus?
Well, I think for this particular outbreak, I won't say being outside WHO has impact or any significant impact on our ability to respond and to this outbreak. And because I think in the very beginning, like, year 2000s or the day before 2000s, we have been trying to get into WHO as an observers. And, but that was, year 2000s, okay? That was the year that we didn't have many experience. But like, as I indicate, the SARS really served as a wake-up call for Taiwan, and we learned a lot, and we collaborate with the US CDC and other countries. And so I think the overall disease control system has been improved a lot. And also in the year 2009, we are able to join the WHO as an observer. So to some degree, we have the experience of being an observer and know, what you can have to be part of the WHO. And so, things change. I mean, a lot, okay? So some of some of the people in Taiwan, including myself, would say, well, it would be wonderful if Taiwan can be part of WHO, why not? But if we can't, it's not really a big deal, okay? We still can fight the disease and, work with people, with friendly to Taiwan, yeah. And I wouldn't say, we are lucky to be not a member of WHO or not an observer, yeah. But I do know some of my colleagues would argue, say, we are lucky that we are not part of WHO. So, we work double hard, to try to protect Taiwan, and also we don't have to listen to what WHO suggested. I won't say that. I mean, even we are part of WHO and observer, we can make our own decisions regardless of what WHO say. Yeah. So, so the short answer is no, I don't think it's really matters in nowadays to be a part of WHO or not. Yeah. But it would be wonderful that we could be a part of WHO, but we are not going to bet to be an observer or a member. Yeah. It's only my opinion. Okay, I have to say it's not an official government point of view.
Yes, it is well noted. Don't worry. So I have another question going back to, I think one of the strategy that Taiwan uses, a broad strategy Taiwan uses to prevent the COVID-19 to become exponential is your great surveillance, right? Case identification, deploying technology, linking up different databases. Now, in the Western society, there's always this question of privacy, confidentiality. So has that been an issue in Taiwan, and how do you counteract with that?
It's always a concern with privacy. So I think one of the things, when the outbreak was at its peak here in Taiwan is probably, middle of March. And, the people are interesting in the sense that, our feelings about things change over time. So when things were tense and when people are panicked, then, sometimes these privacy issues don't seem as important. So people were, some people, you're going to see extremes. Some people are happy that these things are happening. So, we can all be protected. But of course, then there are the few people who are, have become to be concerned about privacy issues. So, and as the outbreak is dwindling here in Taiwan, then these
I think we lost Dr. Wang for a little bit.
Well, maybe I can continue what I was trying to say. Well, actually, privacy issue is an issue. So, but luckily we have been debating that for a long time. Since we have the national health insurance, they collect all the data, issuing the first insurance card, I think many years ago. And so, the privacy issue is over there. So, and so there is a degree of consensus that you need to strike the right balance, okay? And you need to have a sound security arrangements for all this informations. And so if I'm correct, actually, about 2 months ago, actually in the Congress, there's a debate and to how to protect the privacy at the same time to use the information for contact tracing and that sort of things. And so they come up with a solution that they can collect the information, but only with a certain time frame. Like that, if I'm correct, is something like the government can keep the information for, say, 30 days or 40 days, and they have to delete all the informations, and that is the way to protect the privacy. So yes, there is a kind of a discussions, and we certainly would argue that the digital technology we are talking here is more a legal issue than a technical issues, because a country like the U.S. and other developed countries can easily adopt the information and can easily adopt the technology, but you need to take into account the privacy issues, and I think we have been solved that. Yeah. Probably Dr. Chuang can answer the question that, the Congress has decided, we can keep the information for how long? Is something like 30 days or 40 days?
Right, so the Congress has decided that the information could be kept for 28 days.
28.
So 8 days, it needs to be erased. So, so it definitely is a concern, and we are taking into.
I don't know if Bill has any lasting question. Maybe we should also give the audience an opportunity to ask questions as well. Steve, or would you like us to continue?
I think we should let the audience have a chance to ask questions.
Well, we'll get to that, Bill.
Oh,
I just want to follow up on this surveillance. Somebody on the Taiwan side a moment ago talked about the digital fence. And that is apparently a very effective and important part of the Taiwan project. And it's probably the most difficult to begin to think about introducing in the United States, to be more specific. The digital fence is actually a kind of tracing of the movements of an individual who is limited to a small space, usually the home. And when they leave that space, they're engaged in what's basically criminal activities. And the state has the ability to punish them. That would be a tough road if one tried that in the United States, I think. So in a sense, what as a political scientist, I've got to sort of ask myself, what is it about Taiwan that makes this possible? Is it a kind of cultural unity or national unity? Is it a legacy of a more authoritarian past? Why do people accept that?
Okay. I think the digital fence system only a supported system, but it is not tracking the GPS location of the cell phone owner. It use only to identify a person's whereabouts based on the location of his mobile phone relative to the nearby cell towers. So this can reveal the distance of the phone from a specific cell reception tower. So from our law, we did not allow the people to run out of his home if he has the home quarantine. So the digital fence system only a supported system to based on this law to do it. So if we don't have this system, our staff also will call this quarantine person twice per day, and to ask him is he has any illness or is any help need to be supported, or and to learn is he out of his out of. So if we don't have this defense system, this digital fence system, we also if we know these people did not break our rule, these people also need to be get a fine, right? Okay, maybe he can.
Yes. So I just want to kind of jump in here also. The digital fence system is not as rigid as people think it is. So, you know, if people do leave their designated area, the police don't come running over it and, you know, find these people and put them in jail. So basically, if you leave the premise where you're supposed to be, and there is some that you could go a little distance, you know, because with the triangulation technology, it's not that precise. So if people leave their designated area, they actually get a text message reminding them that they are under home quarantine and they need to go back. And as soon as they go back, you know, there's no additional measure that needs to be taken. So, so the digital system, fence system is there. They're using triangulation, but there is, we do understand that there are problems with it.
Well, perhaps I can answer in this way that actually in 2003 when the SARS outbreak, we quarantined many people, okay? And there's a meetings, I was asked by a legal counsel from US CDC, and he was so surprised that Taiwan can quarantine a person without court order. And actually it struck me, you know, we really don't have to have the court order, but it reminds us that we need to have a legal support for us to doing so. So after the SARS outbreak, actually we amended the Communicable Disease Control Act to allow the commander-in-chief to have the power to issue an order like this if he thinks this is the right thing to do. And actually, for the COVID outbreak at this time, the Congress passed another law, also give the authority to the commander-in-chief. We call it a total authority. Perhaps someone will challenge that, but this is a law debated in the Congress and passed. And so I would say that this is is a issue, perhaps is a cultural one, but we in a democratic countries now like in Taiwan, we do need to have that law to be debated and passed in the Congress. So yes, is part of the culture's part of the histories we have because of the SARS outbreak, but also I think it has been done legally and lawfully in Taiwan society right now.
Yeah. Okay. Steve, you want to turn to the Q&As yet?
I think we can do that if no one else on the panel has something they would like to, or an issue they would like to raise.
So I have one question for both of our Taiwanese friends and for Bill as well. Do you think that, I mean, Dr. Guo made reference to the fact that Taiwan has a single payer system and therefore care is affordable and you have a comprehensive database. So do you think that COVID-19 would be a force, maybe this is for Bill, to help the US to move towards more of a single payer system?
Wow.
You can limit yourself to 30-second answer.
I would say I don't have that ability to read the tea leaves. I think the United States right now is in turmoil, in flames, and I don't know how the politics in the United States and the people actually going to be reacting. But I hope personally, this COVID, as well as the death of George Floyd, produced such a huge earthquake. United States will wake up and reform its political and the social and economic system. United States has grown, in my opinion, to be an unequal, unjust society. It's not an exemplary nation for democratic form of government.
Maybe we should turn to the audience Q&A, and I would just say that I look forward to the date when Taiwan open up the border so we can travel there again. And when might that be?
Okay, we currently are enjoying our domestic traveling because currently we don't have any case locally. But when we leave our border, because when we need to, currently we are trying to categorize the risk of the national into 4 categories based on the incidence of the cases, the transparencies of the information, the surveillance and the testing capacity, and the mutual trust, and the next one, the mutual trust. So because we need to have some daring with the country to have such kind of traveling, mutual traveling, travel bubble, such kind of idea. So it need to have some negotiation. So we need our MOFA staff to go that to deal with such kind of information with other country. I think we still at least 1 month later to deal with such kind of information. Yeah.
Great. Let's turn over to Steve.
Yeah, sure. Thanks, Bonnie. One reflection on what Bill said. As I was listening to him, I was thinking that actually the Taiwan experience might be used as an argument against single-payer national health. I can see people in this country arguing that it'll just make the government even more intrusive give the government even more information. And when you've got a population that's talking about their right not to wear a mask, the idea that there would be a central compilation of the population, I think is rather difficult to see being sold. And I think it may in fact be used as an argument against single payer, which is unfortunate. There are two populations in Taiwan that we haven't talked much about. One is the elderly population, particularly old age homes. It seems that that's a center of COVID-19 in the United States. And I was wondering how Taiwan is handling that, old people under care. The second thing, of course, is the Yuanji, the Aboriginal population. I haven't heard much about them or really read much about them. Are they fully integrated into this program or this system as well?
So yes, go ahead.
Well, in terms of the elderly, I think in the very beginnings, we know that there will be the most vulnerable one, like my mom, she lived, well, it's actually, most of the time with me, but, is 85, and so she is the most vulnerable one. So people are knowing that we need to protect the elderly, either they live in their home or they're with their kids. And so as a matter of fact, my mom stayed home even without an order of stayed at home. She stayed at home for almost 2 months already. Yeah, and also for the long-term care facility, I know the government has a special programs to try to, to protect them, to ban the visitors and that sort of thing. So there's a programs on the long-term care. I don't know too much about the Aboriginal people, but I don't think that would be a kind of a problem. But because like you say, we didn't reach the point of out of control. So most of the people in Taiwan are still are pretty lucky, has been taken care well. And so but because the national health insurance cover 99% of people, including the elderly, including the Aboriginal. So they are being treated equally. And so I don't really think that would be a particular problems for those two group of people. Maybe Dr. Chuang or Angela can add on that. Yeah.
Dr. Chuang?
Sorry. Yes, hi, sorry. So with the long-term care facilities, one of the first things that we actually did is to ask people not to go visit their elderly. And it's very, very difficult. So, visitors to the long-term care facilities were limited so that to prevent people from bringing diseases into these care facilities. And then a lot of the other elderlies either are living with their families or have other carers at home. And because everyone is wearing masks, whether they want to or not, and just like what Dr. Guo has said, our elderlies also were very worried about being infected. So they were also staying home and avoiding a lot of places that they would usually meet other elderly people. Our Aboriginal population hasn't really been affected disproportionately. This really is a disease that are imported. So we have not seen the disease being spread in our Aboriginal population.
Well, we have a question from one of our listeners or one of our participants. The question is the applicability of what's been done in Taiwan to a larger context that is has the scale of Taiwan, not the culture, which we've been talking about earlier, but the size. Has the size of Taiwan made a difference in responding to the COVID-19 virus? And if that's the case, how applicable are or what are the more applicable lessons that can be used elsewhere? And what are the less applicable lessons that can be used elsewhere?
Well, it seems to me the size, probably not the size, but being an island has something to do with our ability to control. So like New Zealand, they have been doing that so well with a very enhanced border control. New Zealand have 4.5 millions of populations, and Taiwan has 23 millions in a relatively small island, I would say. So I'm not quite sure the size of the populations. I would probably argue that in a country with 23 million people is not a small size of countries. Yeah, and so, but I think with as you know that we did shut down the borders very early on, and that certainly allowed us to stop the virus keep importing to Taiwan, and that I think that's the key. Probably less to do with the size of the island or the population.
Interesting. Anyone else on the panel? Have I have other questions that I can ask? All right. The issue of a second wave. One of the questions that's come in is about the possibility of a second wave, which is certainly an item being discussed in the United States. What preparations will you be making for a second wave? And if Taiwan's primary advantage or one of Taiwan's most important ways of responding to the COVID virus was to, in a sense, close down the island to people coming in, then the second question is, if there is going to be a second wave, can one think about traveling to Taiwan in the future? Or will that be unlikely?
Okay. Currently, we are trying to promote our people for a new normal to prevent the future disease. So we promote the people who have the social distancing. If they cannot maintain the social distancing, then they must wear the face mask. So in the future, if we open the border, and we want to the face mask to protect our people, not be if there is any infectious case enter into Taiwan, then if we have such kind of personal protective to stop the transmission. This is the first level of protection. Then we also try to investigate the vaccination from our domestic vaccine manufacturer, and also trying to investigate other the vaccine manufacturer in the other country. So to if any chance we can get the enough vaccine in the winter. So that's the current our strategy.
Yeah, I think certainly we are worried about the second wave or the third wave or fourth wave. Actually, in Taiwan, we call the first wave is the wave from the mainland China, and the second wave is from the European and the US. And so now, if we open up the borders, then there's probably another wave. Okay, and certainly even the virus disappear for the summer times, as you said, they probably coming back in the winters. So as long as we are try to open up the border, then we have a higher risk to get the virus coming. And that's why, as Dr. Zhuang saying, you know, the commander-in-chief is really struggling to make the right decisions to when and how to open the borders. And he's suggesting that, you know, they are starting to open up slowly, perhaps for a country like New Zealand or Vietnam or, you know, Hong Kong. I don't know, I cannot say for the government, but I think they are discussing that. And also, certainly vaccine preparedness and production is another big issues. And as I understand that the government is trying to secure the supply of vaccines, given the fact that we do have more than 2 vaccine manufacturers here in Taiwan. One of them are collaborating with a US NIH to have a vaccine for a long time. I mean, they have a collaborations for about 5 years since the dengue vaccine. So, I mean, yes, it's a concern. And like Professor Hsiao said, everything is in, you know, you have to prepare in advance. And so we are doing the same.
We have a question from a Taiwan citizen in Beijing. And that citizen asks, if the WTO was not that helpful, why does Taiwan want to become a part of it?
Well, actually, that's what I'm trying to say, right? Well, let me put it this way. Well, actually, currently in Taiwan, there's a 3 group of people, okay, with regard to WHO. One group of people is that they are arguing that we should be a full member instead of an observer. That's the first group of people. The second group of people, probably the majority of people, they want to be an observer, okay, but is you know, with respect and dignity, and also without, you know, annual invitations, okay. That is another group of people. And the third group of people is, you know, is probably a minority, but that includes me and other my friends that saying, you know, we really don't have to be part of the WHO, okay? This is not a organizations that we want to be, okay? So the answer is that there are people want to be part of the WHO, but also there are people like me, you know, we don't really care about WHO anymore. Yeah, and so it really depends. And as you know that since U.S. Is well, it's not really U.S. Is President Trump trying to withdraw from WHO, then there are another reasons probably Taiwan cannot or should reconsider our positions. By the way, you know, my deputy president is a former AIT director called Bill Staten. Probably you heard about him. He is now my deputy in National Yang-Ming University, and he is one of the people arguing that Taiwan need not to be at WHO, and so does USA, and so there are people, probably have a different views. So that is, I would say, the attitude is changing rapidly.
Winnie, did you have a question?
I was just wondering if we can have our friends from Taiwan touch on a little bit on, you don't suffer from, major economic shutdown, shutting down school, etc. But with the tight border control, how has that affected the economy? Is that one consideration in terms of thinking about opening up?
Well, like Dr. Chuang said, earlier, that we are seriously considering opening up the borders and open up the economy. For the domestic economy, actually, we never shut it down. So it's right. Probably, say 90%. And people are scared to go to the restaurant. That's for sure. But for most of the activities is relatively normal, yeah. But you are absolutely right that we need to open up the borders sooner or later. I would argue that actually in Taiwan, we are probably a little bit too obsessed with zero cases, especially when you are talking about all the asymptomatic cases. So the cases we know is the cases we detect. They're probably cases that we didn't detect. Although I don't think there are many undetected cases. Okay, so what I'm trying to argue is that we should open it up. Okay, maybe there is new cases and even local transmissions. But given the fact that Taiwan has the ability to control it, why not we just open it up, tried it, and since we have a very good and robust surveillance system, right, we can detect it right early on, and then we stamp it. Yeah, so it probably, after you open the border, there's a kind of a bliss, all the way, but it's not going to hurt. Yeah, and that is the way to go, I would argue. But the government probably have their, thinking. But basically, we are at the time that it's about time to open it up, or the list to try to open it up. Yeah. So, and I just heard Dr. Goldstein say there's a audience from Beijing, right? Yeah, and actually, many of my students is now in Beijing, couldn't come home, right? come to Yang-Ming for the graduation commencements, and we have been in teleconference many times, and I wish we can get them back to Taiwan to continue their educations, but still is under discussion, is not being resolved, and so we are pretty much like, to open up the border and have them to come back. Yeah. So But I'm pretty sure that we are in the good hands. Dr. Zhuang and the Commander-in-Chief will make the decision, the right decision pretty soon.
Could you've used the term Commander-in-Chief a number of times. Could you just define whom you're talking about?
Okay, yeah, well, actually, this is the question that Winnie just asked about the governance, okay? That's, we learned in SARS outbreak. So I keep saying that SARS is the wake-up call for Taiwan. We learn a lot, and that is one of them. You know, during the SARS outbreak, we have that fight between the central government and the local governments. And we don't know, you know, who should make the final decision. So after the SARS outbreak, and actually during the SARS outbreak, we come up with this idea that we need to have someone really have the power, you know, to make the command. So at that time, the President Chen asked a former health minister, Professor Lee, that Bill know very well, to be the commander-in-chief, okay? And so later on, we kind of legalized the terms and we put it in our law and say, once you have an outbreak of like this, and then the government can activate the commander in the Central Epidemic Control Center, and then appoint a person to be the commander-in-chief. And so just like Dr. Zhuang just mentioned, you know, if it's in the early phase of the outbreak, then you ask the director of Taiwan CDC to serve as the commander-in-chief, okay? If the epidemic escalate, and then you will ask the health minister to be the commander-in-chief, okay? If it escalate again, then you will ask the premium or the vice premium to serve as the commander-in-chief. Once you use the term commander-in-chief, you are switch into a commanding mode, okay, like fighting a war. And so that is a way of communications. That's the way of telling the public that we are in a different mode. He is not no longer a health minister or director of Taiwan CDC. Now he has embraced a bigger power and we are fighting the disease. So it's a matter of communications, yeah.
We have another question from a participant. How will the United States' apparent withdrawal from the WHO affect Taiwan? Has that been a source of information for Taiwan in the past? In other words, the United States is talking about withdrawing, or the president's talking about withdrawing from the WHO. Will that affect the information flow to Taiwan, which we assume has indirectly come through Washington to Taiwan, or from the CDC in this country to Taiwan?
Well, I don't think so. Well, you know, other than the United States, we still have, you know, 20-something allies and who has been in the WHO as well. So if we are talking about getting information through US, then it won't be changed because we can still get the information from other allies, okay? So I don't think that is a big difference, yeah. But it will make a case for Taiwan that since even U.S. doesn't want to be a part of WHO, then the argument that, people say, why we should be a part of the WHO will probably grow louder. Yeah, we will sort of stick with the U.S. and we probably can have our own organizations like some other people argue. So I think if the U.S. withdraw from WHO, then there were more people arguing for not to be with WHO anymore, and that's that's probably is going to happen. Yeah.
All right. Any members of the panel have anything that they would like to add to that?
I just want to convey a message from Michael Zongyi, the director of Fairbank Center, that he want to express his welcome, but also appreciation for our Taiwanese speakers sharing the experience with us.
I would say whether Taiwan become a member or observing WHO needs to be looked at in a larger context. Whether Taiwan is being recognized in the world international organizations, and WHO membership give Taiwan the most legitimate reason to say, I am part of the world, and with infectious diseases, viruses that do not respond, do not respect national boundaries, every country should be in it. And I think that's the argument. Not necessarily Taiwan will receive that much direct benefit, health benefit, because actually WHO information and standards set by WHO and the information generated by WHO, that's made public immediately. There's no secret, and Taiwan being a member or not member doesn't really get that much benefit. So it's a larger question rather than a simple health question, whether Taiwan wants to or should be in WHO.
So in a sense, it's probably more a political issues than just health issues, I would say.
I think that's the way it seems to me as well, that it is all part of Taiwan's wish to increase its international profile. And what I found very interesting about our discussion today is the fact that in terms of control of the disease and Taiwan's response, the WHO is not considered to be that important. And in fact, some of our participants have speculated that non-membership in the WTO was actually an advantage. And that's one of those chance occurrences that happen in history and make a difference. We're coming to the end, and I can't resist, as a person who taught at a women's college, Smith College, for a very long time, to note another happen chance, and that is that Taiwan has a female president Some of the most successful countries in the world, I have been told over and over again, have female presidents. Germany, Finland, New Zealand, Iceland, Denmark. So perhaps we should include that as a factor as well, though it isn't very scientific, I admit. Anyway, I do want to thank our panelists. Did you want to say something, Dr. Chuang?
Oh, thanks. It's my pleasure to join this online presentation, and it's very interesting and nice to discuss it. Thank you. It will.
Thank you for having me.
Well, thank you to all of you. We've just been listeners. You've been doing the work. Thanks to Winnie, thanks to Bill, thanks to the people on Taiwan, and thanks to the participants. I'm sorry we couldn't use all the questions that we got, but I think it was a very useful session, and we appreciate everybody's efforts. Also, I should mention Mark Grady at the Fairbank Center, who was able to put together this technological miracle. So thank you all.
Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
See you in Taiwan. Order.
Hope so.